Hi friends, welcome back to allornonelaw. This is a surgical clinical vignette. Here I'm going to give you the clinical history and you have to tell me the diagnosis, management or the next step, whatever. So let's start. Okay, a 45-year-old man, 45-year-old male, okay, he was driving a car with a high speed, he stuck on a pole, he hit what do you call a telephone pole. Try to concentrate on the clinical history, guys. Very important for USMLE. Telephone pole. Okay. Right. So now he is taken to the ER, emergency room. Okay. So he's a shortness of breath, has a multiple bruises over chest, multiple bruises on chest. Okay. And when you palpate, when you palpate over the chest, there are multiple what you call tenderness. Of course, there should be, right? When there is a severe crash, car crash, you take a chest X-ray, and the chest X-ray reveals multiple rib fractures, multiple rib fractures. Okay, on both the sides. So when you start examining his lung or chest, you see that on right side, or you can take it as the left side. Okay, let's take it on the left side. On the left side, the chest wall caves in when he inhales. Caves in when he inhales and bulges out when he exhales, and bulges out when he exhales. So these are the two important points what I want you to concentrate on. So left side, the cave, there's a caves in when he inhales, it goes inside when he inhales and bulges out when he exhales or when he do expiration. Okay, so what's the diagnosis? I think most of us know the diagnosis, right? It's 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 flail chest. So it's a very easy to diagnose now. How do you manage? Tell me. To manage, you have to look for three things. Three things are really very important in this. The one is what's a thing right now means what you have to do for this obvious lesion right now. Okay, obvious. What's the treatment of this obvious lesion? And the second is what's going to happen in 2 to 3 days or 1 to 3 days. Okay, and the other one is there any silent killer like aorta injury? Okay, right? Excellent. Now in this case, if this obvious lesion is a flail chest, we know, right? So what you have to do, the underlying problem is a pulmonary contusion. Okay, and this pulmonary contusion is treated with a fluid restriction. Fluid restriction. If you want to give fluids, you can give diuretics along with that. Okay, and what you have to do, you have to monitor the patient. That's really very important. Okay, because what happens when there's a ribs are broken, these broken ribs can injure the lungs later. Okay, that's why you have to monitor the patient. And the other reason you have to monitor, I will tell you, for the any kind of pulmonary or myocardial contusion later, okay, in next 48 hours. That's why you have to repeat the chest x-ray, blood gases, EKG for pulmonary contusion, and troponins for myocardial contusion and myocardial contusions, troponins. Okay. So now, if I want to tell you that, can I ask you one thing? That's tell me whether this aorta is injured in this patient or not. If yes, why? If no, why? Here, the aorta is not injured. Why? Because if you take a chest X-ray, the chest X-ray shows only multiple fractures. He has not mentioned of any widening of the mediastinum. So remember, whenever they in examination, if they give the widening of the mediastinum, think that the aorta is injured. Remember, okay? So chest X-ray, aorta wide mediastinum, then think of what you call aorta is injured. So what do? Take a CT, CAT scan. So do what you before that is a non-diagnostic, right? Do arteriogram. Do arteriogram. If no wide mediastinum is there, spiral CT shows no aortic lesions, so no further workup can be done. Okay, right? Got an idea? Chest X-ray, no wide mediastinum, and even spiral CT shows no aortic lesions. No further workup is needed. But if the chest X-ray shows wide mediastinum, means aorta is injured, so do arteriogram. Okay, CT, that's a CAT scan, is a non-diagnostic. Okay, that's it, guys. So flail chest is really very important topic for USMLE. Thank you so much for watching this video. Take care.